Good morning, everyone.
Morning.
Oh, come on. Let's get excited. You're here for a great reason. It's a great conference. Let's have a great day. I'm Wendy Nilsson. I'm at the Office of Behavioral and Social Sciences Research at the National Institute of Health. And I have an absolutely amazing panel today. And we're going to really talk to you about how to get the amazing work you're doing funded. So Sylvia Spengler and I have slides. We're going to give them to you later, but we're not going to use them now. So what we've decided is to do a panel that really goes from your most basic science in health IT and economics all the way through our most applied in what we fund through the federal government. So my colleague Sylvia Spengler at the National Science Foundation is going to go first. She's going to talk to you about some of the opportunities at the National Science Foundation. I'm going to go second and talk to you about some of the opportunities at the NIH. And last, my colleague John White from AHRQ, which I can never remember what AHRQ stands for. Oh, Agency for Healthcare Research and Quality. ARC. You know, when we get to the point where you've been in government long enough, you can't remember what the acronyms are anymore. But John White's going to talk to you about some of the opportunities that AHRQ has. So we're going to have plenty of time for questions at the end. Again, we're going to have some slides available for you that'll have much more finite, granular data in it. But right now, Sylvia.
So my name's Sylvia Spengler, and I really am happy to be here today. I'm going to tell you about the Smart and Connected Health Program for the National Science Foundation. This is a program that's about 3 years old. It's gone through a couple of name changes, but the focus has stayed the same. What we're trying to do is, as a goal, is to have safe, you all know the buzzwords, safe, effective, efficient, equitable, patient-centered innovation in computer science, in social, behavioral, and economic science, and in the engineering sciences. We have a program, we have a solicitation. We don't give a lot of money, right? Our awards tend to be somewhere in the $750K to $2 million range. But we have a current solicitation. We have a deadline today. Forgot that one.
Go.
Right.
Right.
Yeah, fast. You've just got to have your sponsored projects office in your right hip pocket at all times. No.
Chocolate.
However, December might be a doable date. I really encourage you to look at our solicitation. The number is 13543. 13543. The formatting, to tell you the date, is almost illegible. It's a user-centered design problem that hasn't been fixed yet in our system. Anyway, but the 10th of December is the golden day that you need to remember. The next thing you need to know is that we will, of course, expand and extend it. Let me tell you a little bit about what our areas are and what we're hoping to do. We have an area in digital health infrastructures. Basically, I heard it already in the first panel. It's data where it's needed, when it's needed, and when it's wanted. We have a focus on the classic data to knowledge to decision paradigm. And we're hoping that this will help promote evidence-based medicine. We're looking for mechanisms to empower individuals. This is particularly critical. I'm really happy that Anand is here because WellDoc actually did think about the users. The user interfaces are a part that are really, really missing in a lot of what we get as proposals. Looks lovely to a computer scientist, looks reasonable perhaps from the delivery perspective, but from the user perspective, it's horrible, to be polite. And then there are the classic sensors, devices, and robotics, because as well as everything else, we care about quality of life. We have, as I said, the three directorates involved currently, computer and information science and engineering and all parts of that. We have social, behavioral, and economic science, and we have engineering. I want to actually encourage people who think about healthcare from an economics and a social and behavioral perspective to actually consider coming into the program. And even more importantly, think about becoming a reviewer for the program. Both of those are necessary. We are trying to build this area so that it doesn't just look like computer science navel gazing. We're trying to make it so that it's clear that there's a handshake. We require a handshake of a medical problem and then of health professionals, particularly in the larger awards. But let me encourage you to think about what your interesting research questions are and how this program can be a vehicle for funding your research. Thanks.
Wow. You were quick. Good morning. I'm Wendy Nilsson. So the National Institute of Health is much more complicated when it comes to funding this research. We have huge programs in this. And I guess there's two things that I want you to remember, and I'm going to ask you to repeat this to me at some point, is it doesn't have to say health, IT, or economics in a funding announcement. Okay, got that? Everybody comes to me all the time and says, I have to do this project and it's so-and-so and so-and-so, but I can't find an announcement. That's never true. We have parent announcements at NIH. That's where all our best ideas come in. So, A, it doesn't have to say health, IT, or economics on it. And B, you have to talk to somebody at NIH. The last thing you ever want to do is put a proposal into NIH and never talk to a program officer. If I see it, the first time I see your proposal is after review or in review, you're not going to get funded. The people who get the most funding from NIH know to talk to program officers. That's what we get paid for. We like you. Most of us are friendly, although, as my colleague says, you know, we're a bunch of really friendly people with a few cranks. So if you get a crank, talk to me. I'll find you somebody friendly.
Just to be fair, I bite, so.
You've
been warned.
See what I mean? There's lots of really friendly people. So, and then the other thing to remember is it's the National Institutes of Health. There's an S. We are not one. We are a federation. Think of the United States. You don't talk about the same things in California as you do in Alabama. Well, guess what? At the NIH, it's the same way. So, boy, this is really psychedelic lighting, isn't it?
It is. I'm trying to think what the message is. I'm sitting as
we're wondering if they're
Morse
trying to
code?
program.
I think the phrase you're searching for is seizure-inducing.
Oh, seizure-inducing.
It's not fast enough, I don't think.
Okay. So the thing is that remembering that every single institute has a different mission. So if you don't think about their mission, so if you wanted to come in, if you were doing something like Anand was talking about, you don't send that to the Heart, Lung, and you don't send a diabetes project to the Heart, Lung, and Blood Institute. They don't care. I mean, it's not that they don't care. They do care. But we're divided up by organ systems and populations and all sorts of things. So how do you figure out where you send it? Come on. I already gave you the answer. Yes, talk to a program officer. And now you know one right here. So you can send me an email and I will triage you. I will find you somebody who cares about what you care about and you will talk to them before you apply. You always email us. You never call us. Why? I ask. Well, look where I am right now. People are calling me at my office and I'm not there. I'm never there. I spend half my time at NSF, half my time at NIH. I'm on the run constantly. If you're not in my iPhone, I got to respond to you that way. I will set up a time to talk with you, but I'm not easy to track down on a as you need to know basis. So, and that's the same for all my colleagues. We're in review, we're running around, we're in the community, we're in conferences, we're trying to keep up with you all. So there are some areas that really have been a target in health IT and in economics. We did have a common fund initiative that was health economics. That's coming to a close, but you can take a look at some of the stuff that was funded. We will continue to fund work in that area, just not through that thing. We really wanted to stimulate work in this area, to really look at how do the investments in NIH, how do we think about them? How do we, one of the things we want to see is that they make a difference. And some of the economic research gets us there. We also, as many of you know, anybody that knows me, we have a huge interest in mobile health. So we do lots of work in mobile. I run the NIH Mobile Health Work Group. We're called Empower for a reason. We're really excited, and I'm connected with 90 people who care about it throughout NIH, all the way from biofluidics that are mobile, all the way up to using a tablet to mark pain. it doesn't matter what you're doing. We have an interest in, depending on who you talk to, there's interests all over. We will be making an announcement in the near future for a project that we did a notice of intent to publish earlier this year. We're actually going to get the thing published shortly. So that'll be exciting. But, and as Kevin mentioned, we just funded our big data to knowledge centers of excellence. I am so happy to say that 2 of them focused on mobile. One of them is in the University of Memphis, and that is mobile big data to knowledge. And one of them is in Stanford, which is looking at its activity recognition in the mobile space. So huge area of interest. I think we have the NIH management interested and excited by this now. We certainly have our big data folks realizing that mobile is a huge big data opportunity, and it's an opportunity to collect data we've never had before. In the health, more traditional health IT space, we always had room for that, and we've always done that. We've funded projects we've funded all sorts of projects in that area, and we really, we're all about how do we improve health, how do we improve measurement, how do we understand disease trajectories, so we have modeling. I'm actually on a computational framework for behavior and social issues. So, we really like this. We really want it. So shoot me, I'd say give me a call, but that was a wrong answer. I already told you that. Don't give me a call. Shoot me an email. The other thing I want to say is if you've never been to NIH before, if you've never gotten funded by NIH before, there is an early stage reviewer. It might have a limit on how long you've been in the field, but that will allow you to actually sit on a panel in review and actually review some grants, see how it is in NIH. We have a culture. We definitely have a culture in review, and it lets you see it. So again, if you're interested in that, I'm going to make the slides available. It has a link to that, but you can also email me. So thank you.
All right. So this is kind of like, the 3 tenors, right, when they go to Wolf Trap. So this is a lot of fun, actually. This is we do not get the chance to do this often enough. Tremendous colleagues up here, and I thank you all for coming to the White Conference.
Oh, yes. John's conference.
Right, John's
So now, seriously, thanks to my colleagues at the University of Maryland for putting together an outstanding... Yeah.
Did you tell your kids about this morning?
So actually, how many years running has this been for the White Conference? 5th year? Okay. And I was there at the first one, right? Yeah. So we are one of the supporters of this conference and have been over a long period of time. And 5 years ago, I told the kids, I'm like, hey kids, guess what? It's the White Conference. And they're like, I'm like, oh, thank you. All right, guys. So yes, I am John White from AHRQ, John of Arc, and I am the director of what is now the Division of Health IT at AHRQ. We had a slight reorganization for a long time. I was the portfolio director at AHRQ, and there's still a health IT portfolio, but essentially that's just names. There is a corpus of really great folks at AHRQ, some of the outstanding project officers that Wendy mentioned. Some of them live at NIH, some of them live at NSF, and there's some at AHRQ. And we focused on health IT for a long period of time. ARC and its predecessor agencies, AHCPR, and really before that, the National Center for Health Services Research, if there's anybody that goes way back, have funded work in the use of good information tools and systems in the delivery of healthcare for a long period of time. So it's been around for a while. ARC funds health services research, okay? So the flavor is slightly different from the folks that are setting up here, which is why, 3 different funding agencies exist for work like this. But really, this is what, you're economists, so you probably, at least some of you read the Harvard Business Review. You all have heard of wicked problems in the world. And, the use of health IT to improve the quality of healthcare is extremely promising, but it brings up some wicked problems. So you've got to approach it from, a lot of different directions. So, hence the opportunities from the 3 of us that are up here. ARC has been busy of late. We have had a new director for the past year, which is very exciting. His name is Rick Cronick. He came to us from the Assistant Secretary for Planning and Evaluation. Rick is different because he's not a clinician. So he's a political scientist, but boy, he sure acts like an economist. He denies this, by the way, not feeling the love for the crowd here, but he sure acts like an economist. And those of you here probably also know that ARC has, out of the 6 floors at ARC, one floor is economists, because we have the Medical Expenditure Panel Survey and we have the Healthcare Cost and Utilization Project, HCUP. Very interested in this subject generally. So over the past year that Rick has been at AHRQ, we've taken a look at our funding opportunities, and we've slightly rewritten the mission, and we've just issued new funding announcements for our R01s and our R18s. And I actually wanted to take the opportunity to read them to you because I thought it would be particularly salient to our discussion. So, and I quote, this is right from my website: "The ARC mission is to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable, and to work with HHS and other partners to make sure that the evidence is understood and used." So part 1 is pretty consistent with what our mission was before. Part 2 was implicitly part of our mission, but never explicitly stated. So it's nice now that there is something very clear from the agency director that says, and we're going to work with others. And we do. Not only do we work with NSF and NIH and our other colleagues that are in the funding area, and DARPA and other folks as well, we work with those who are building policy and creating regulations and working with the levers. So we work very closely and have for years with CMS and ONC and the FDA and HRSA and our other folks in the federal family that are involved with trying to make the changes that are happening. So and it's important, right? Those folks want to be informed by the best evidence and policy that can be found. And then that's where you all come in. You all come to us for funding. You create evidence, we work with those folks, and you can work with them too to make that evidence understood. So within that mission, Rick established 4 very clear priorities. I'm also going to read those to you. So first priority is to improve healthcare quality by accelerating implementation of patient-centered outcomes research. The second is to make healthcare safer. The third is to increase accessibility by evaluating expansions of insurance coverage. And the fourth is to improve healthcare affordability, efficiency, and cost transparency. So all of those have a reason for being anchored at AHRQ, and I won't bore you with the details of them, but those are the pretty clear priorities that are established. So for those of you who are interested in getting funding from AHRQ, and I encourage you, look, you are of course welcome to email us, but first probably go to the website and take a look at the funding opportunities. Otherwise, we'll refer back to them when we start talking to you. And review those and try to figure out how your work fits into one of those priorities, because when you come to us and you send in an application and it goes through the peer review process and then it comes up to the funding council, okay, Rick is going to want to hear which of the priorities does it address. So that's my sage advice to you in terms of looking at that. So that's broad ARC work. Now let me focus a little bit down on health IT. So ARC is a $400 million agency, give or take. Health IT is a $30 million program within that, okay? So of that $30 million, this past year, $24 million of it went for grants, okay, research. Because again, it's a preponderance of what we do is we produce evidence, and grant work is largely how that's done, although there is some work that's done through contract. We had several opportunities, funding opportunities open. Some of them have recently expired, and we're in the process of rewriting them. But the one health IT specific funding opportunity that we have open is an R21, small research demonstration projects, and in health IT. And we asked for 3 types of projects, and in particular, one of the 3 things that we asked for are economic studies, okay? The door is open, people, and it has been. We've actually had this funding opportunity out for a while, and the ones previous to that also said economic studies. So consistent with the past 5 years of wanting to be supportive of this, this conference in particular, but this community more broadly, we want your funding opportunities. And I will tell you that, yes, I have a great team, and there are project officers that, as Wendy said, if you email me, I will triage you to the right people. But I will tell you, John White, director of the division, personally go to the review panels where the expert panels come in. I take a look at all the applications that come in. My staff work with me to do that. I sit there and I listen to them as they're reviewed, okay? And there's some, but there's not enough, okay? I've been there, seen it, I've done it, I've funded them, I know it. So come on, bring them in. This is your opportunity. So, and again, now these opportunities are not huge, okay? But I think that's probably okay. You all can take good ideas and you can get them focused and, bang on them really quick. You can produce some quick results. That's the idea of the R21 is it's 2 years of funding. So for you to produce preliminary results that then lead to the bigger studies. So, we're out there. We've been out there for a while. We're absolutely interested in your work. We think it's absolutely key to understanding how you use health IT to improve the quality of healthcare, which is, again, at the basis of what the ARC mission is all about. So I'm going to use my last 30 seconds to say that, and this is a diversion from funding stuff. I just want to say, hey, Regina Holiday, how are you doing? So if you have not met Regina, okay, Regina is a long-standing friend. I'm sorry, Regina, I did not drop any good jokes in my talk this time. I will come up with more later. She is a wonderful individual. If you don't know her work, please stop by her in the back and learn more about her and what she's doing and the fantastic work she does. So thank you very much.
See you wherever. So, we talked quickly, so we had time to answer your questions. So, use the mic.
So, John, to your point about wicked problems, so one of the wicked problems in this space where we all work is that our work is so fundamentally interdisciplinary and transdisciplinary. And having served on panels at both NSF and AHRQ, I think the conversations that take place for the types of applications that people in this group would put in are sometimes talking past each other. So my question really is, what are we doing to address the challenge of getting together panels where people can look at this animal from all 4 angles or all 360 sides?
You want to go first?
Sure, I'll start. So we have 2 mechanisms to do that. First is we engage directly with the program officers in economics, in social behavior and economic science, to make sure that we get their input on who might be appropriate. But let's be honest, there's a fairly small set of people that cross interfaces with facility and agility as far as review is concerned. We give you an opportunity to tell us who those people are. There is a mechanism at NSF to suggest reviewers. I strongly encourage, particularly in cross-disciplinary fields, to do that. But if you look at my panels in Smart and Connected Health, for example, or in cyber-physical systems, you'll see people who by necessity must learn to talk to each other across the course of the panel and across the course of discussions about each proposal. So I think that we have mechanisms to help address this problem, and I'm encouraging you to come again to a panel.
Yeah, I just want to say, I think this is a great point, and it's a point we all agonize over. So, if I send out a request asking for people to review, what's the answer?
Why, I'd love to do that. Thanks.
But I'm busy.
No!
I'm going to Tahiti. I'm off
I'm writing
to
a paper.
Paris.
I need
an
some
application.
sleep.
I need
yes,
some, yeah.
no. Not
I'm
the
expecting
right
a baby.
answer.
The dog ate my homework.
If you're not part of the solution, you're part of the problem. So there you go. End of conversation. So when I send out a request, and by the way, if you get it from me asking about Smart and Connected Health, say yes, because I give all those people to NIH too. So if we ask you to review, it's a pain. Anybody that reviews, it takes time, it takes effort, but you will learn. And you will meet new people you've never met. And let me tell you, some of these panels, you meet people you want to work with. So do it, but be a part of the solution, because this is something that pains program officers.
So, excellent comments. Let me add the following. So fundamentally, what's our job up here, right? The job of the people up here. So our job, in my opinion,
Go for it,
is to think about the really vexing, burning problems and questions that people are going to have in 5 to 10 years. Because those are the questions that we'll have answers to for the research that we fund. So if I think about what people are going to be worried about in 5 to 10 years, okay, I can gather the information that I need, work with my team, write a good funding opportunity, put it out there, let you guys scratch your heads for 3 months, write an application, get it submitted, get it trashed by the review committee, rewrite it, send it back in, and get it funded after your second, after your resubmission. And then you've got 2 or 3 or 5 or 6 years, depending on whether you ask for a first or just a first or a second no-cost extension, and finally publish your papers. Okay, so what that means is that we've got to be, we've got to look at creative ways of solving some of these kind of weird problems and vexing problems that are out there. Those clearly require people not just staying in their lanes where they are currently. It clearly requires people expanding out beyond, expanding their vision, which is hard, right? When you're an expert in a field, there's this great cartoon of how people develop from primary education to secondary education to college to getting their PhD, and it's this globe that expands and then starts pointing out in a specific direction, and then eventually it goes boink, and that's your research and how it contributes to the knowledge of the world, right? When you're in that channel, it's so hard to break out of that, okay? And Ritu has been in part of the conversation, right? You've been seeing that hard thing. So we tee up these challenging funding opportunities, and actually the R1s that I mentioned that just closed are a great example of that. So typically in the past, ARC has funded people had great ideas for a decision support application or something for health information exchange or something like that, e-prescribing, and they wanted to implement it and show how that affected that clinic and the outcomes for that clinic. And that's a pretty straightforward and time-honored approach of way of doing things. In 2011, we published funding opportunities that asks folks to come just one step upstream from that. Okay, we asked people to first start by understanding the information needs both of clinicians and consumers of healthcare. Okay, and start with that, understanding what those needs are. Okay, and then trying to investigate how health IT can address those information needs, okay, in seeking better quality healthcare and in delivering better quality healthcare, okay? To none of your surprise, that was written by the industrial and systems engineer that is my chief of health IT research at AHRQ, okay? It has been fascinating watching both the field deal with that and sending an application saying, right, here's a great app that I've got, and I really want to evaluate this. And it's like, no, step upstream with me a little bit. And then to watch the study section grapple with that, right? Because they had to get their heads around that too. And it has required difficult communication. So some of that gets hashed out at that level. I haven't figured out a faster way to make that conversation happen and to plug people in other than making them sit down and do it, except to put funding behind it. Okay? Because if I didn't put funding behind it, it wouldn't happen, largely. So I'm open to new ideas or new thoughts. It is challenging, but it's also important. So, I'm going to encourage you to both bring your tools and applications, but also to kind of expand the thinking that goes along with that. So, thanks.
Other questions? Oh.
Nope.
So, thank you very much for the great panel. So I just learned that for NSF, NIH, and ARC, you all have your priorities of funding, which is very important. I'm just curious, how these priorities are produced. That is, who make these priorities, and are we, as audience, be able to provide feedback, on those priorities? Thanks.
So the priorities rise in two ways. As far as innovation is concerned, that's our bread and butter at the National Science Foundation. There's just no two ways about that. That's what we care about. We care about driving the nation's health, the nation's security, the nation's economy through innovation, period. And yet, how something like the Smart and Connected Health program happens, sometimes it's a bunch of program officers get together and go, we talk to each other. We may be on 12 floors, but we talk to each other all the time. And so conversations arise and you go, well, this is an interesting area and nobody's doing anything in this area for fundamental science. Sometimes, if you're really lucky, you can engage somebody in management and they'll help you make it part of the ideas that get discussed at the uppermost management level for the budget. That's usually how we actually end up with a real program. We almost always start small, and we often have workshops. So the question is, whom to invite to workshops? How do you engage? One of the ways of doing it is to volunteer to be a reviewer, because once you've been a reviewer, we have a much less structured process than NIH. But once you've been a reviewer, you're on everybody's mailing list and radar. We have some idea of what you're interested in. So putting together a workshop brings you into the picture. We sometimes put out RFIs. What do you think are the really interesting problems in this area? We actually hold public meetings, and anybody can come with a couple of keynote speakers, but lots and lots of additional people involved. So those are our key mechanisms. And then every now and then we'll get somebody in the National Science Board will have a great idea that's something that needs to be done, and that pushes it from the top. But most of the time it's somewhere in the intermediate up to upper management levels where the ideas come from, with community insight.
Yeah.
Oh,
Okay.
sorry.
You guys have so many brilliant ideas. They think I need a microphone.
No, yeah, I was hearing you just fine, Regina.
So you have so many brilliant ideas that are shown to you, but you do have limited funding, correct? You only can give out so much funding. So one of the things that I have heard from a lot of research scientists is this frustration. We didn't get the grant, and so we gave up. And I'm like, did you think about crowdfunding? Did you think about the fact there's other ways to get to the point that you want to go to? So one of my questions to you is, one, do you throw that out there of do not give up? You didn't make it this time, but there's other avenues for you. And two, the other element I've found that people don't follow through is because there's a prestige that goes with a grant that crowdfunding does not have. So how do we create the prestige to allow these people to go on with their amazing research?
I told you she was good.
Yes. So I actually run a listserv, and it'll be in the slides, that actually pushes out funding from sources you would never believe. I mean, I sent out Pharma's Foundation Awards yesterday because there was a whole computational section in there. I mean, why not? I send out, if the Google Foundation, if Verizon Foundation, if anybody, I'm on our citizen science and work group, and we're trying to think about crowdfunding and how do we help people. But, there is, you can do your job as citizens and advocate for the science agencies to continue to have the money they have. We have flat or declining budgets. We do have more great science than we can fund, and that pains us. But if you're talking to your program officer, you'll often find out that they're very creative in helping you think of other sources. NIH actually funds something called the Clinical Translational Science Awards, the CTSAs. Many universities across the country have them. They have some seed funding. Somehow they don't seem to tell everybody they have that, but as a program officer, I can nudge. So, we can help you think creatively about what you do, because this is painful. It's a hard time financially.
So let me flip over to the other side for a second. Okay, audience participation time. You ready? All right, raise your hand if you are from an academic institution. Okay, down. I'm sorry, raise your hand if you are not from an academic institution. Okay, there's some of you out there. Okay,
Yeah.
so within academic institutions, right? There's a slightly hidebound process on our side, okay, on the Fed side. There's also a slightly hidebound side on the academic side, right? Kind of a way of doing things and approaching things. I will say that there are certainly places out there within the academic community that think about it differently. And we could probably name them right here, so I'm not going to. There's the way that you declare success within the academic community, the way that you gain that prestige, you just mentioned it, right, is something that's to be grappled with and dealt with. I think that there's, right, evolution happens for a reason, and there's some evolutionary advantage to that approach for doing things. But you worry that if you go too far down the road of having a particular type of beak for eating a particular type of fruit, and the fruit changes, that you're going to starve. I do worry about that evolutionary drift in terms of how you support great work. So I'm open to ideas too, for what it's worth. Okay, good.
Sylvia, do you wanna?
So one of the ideas that we've been batting around with some modest success and some modest anxiety is a question of how to more engage the community, the broader open community, in actually evaluating the work. So that could actually both encourage outside funding as well as engage different people and different perspectives.
So Sylvia, are you talking about maybe somebody gets funded to generate data, and the data gets put out there and other people can evaluate it?
Well, so that's part of it, or the thing is, how do you essentially crowdsource review? It's a discussion process. Don't suddenly get the sinking fit about that idea.
Yeah. So another way of thinking about that is the data that we as the federal government generate. Earlier I mentioned MEPS and HCUP, right? Those are large projects where we generate large sources of data. And as far as I know, the Medical Expenditure Panel Survey is the only ongoing source of what Americans spend on their health care, right? So maybe I'm wrong. I could be wrong. I'm not the MEPS project officer. That data those data are out there on a regular basis for people to analyze. Yes, we analyze it at AHRQ on an intramural basis, but that's another approach to how this information is generated and how you might be able to get at it.
So, Kenyon's standing here. He's menacing us. So,
Yes.
So thank you for having us. It's a blast being here, and we're really excited about what you do. So contact us and submit great ideas, and make sure you agree to review. Thanks.